everyone taking time out of their day to join me for Tuesday Tips with Taylor. Here at Always Best Care, we strive to provide solely non-medical care for our clients of the same quality we provide that care for a loved one. This week, I wanted to shed some light on seizure awareness and first aid. Seizures aren't talked about nearly as much as they should be, especially with 1 in 10 people experiencing a seizure in their lifetime here in the U.S. Seizures are diagnosed by an epileptologist, which is a type of neurologist, through a test called electroencephalography, or an EEG. According to Johns Hopkins, during an EEG, about 16 to 25 electrodes are placed on the scalp to measure electrical impulse, specifically abnormal electrical activity within the brain. There are 30 different types of seizures, and they can be caused by anything from a head injury to epilepsy, a brain tumor, or an infection, just to name a few. The two main groups are generalized seizures, which affect both sides of the brain, and focal seizures, which affect one side of the brain. There are 2 types of generalized seizures. The first is absent seizures, which cause rapid blinking or a sense of somebody spacing out for a little bit. And then there's tonic-clonic seizures, which are also known as grand mal seizures. These are bigger and can cause vocalization, loss of consciousness, and muscle spasms or jerking movements. Tonic-clonic seizures are often what comes to mind when people think of a seizure. Focal seizures consist of 3 different types. There's simple focal seizures, which can cause a twitching or a change in taste or smell. Some people often describe what's called an aura, or an unusual feeling before having one of these seizures. Complex focal seizures are in this group too. They can cause confusion, disorientation, and an inability to respond to questions or instruction. And then there's secondary generalized seizures, which means that someone starts with a focal seizure that then moves to the other side of the brain, causing a generalized seizure. Knowing seizure first aid can help prevent someone from injury during a seizure. According to the CDC, when someone is experiencing a grand mal seizure, you should lower the person to the floor, roll them to their left side with their right knee positioned in front of the body at a 90-degree angle. This is called the recovery position and can help prevent regurgitation and aspiration. You want to clear the area of any hazards. Put something soft and flat under the person's head, like a folded sweatshirt or a towel. If the person wears eyeglasses, make sure to remove those. Loosen anything that may be around the person's neck, like a necktie or a scarf that may make breathing more difficult. And make sure to time the seizure. If a seizure lasts more than 5 minutes, you need to call 911. You should never hold someone down or try to stop their movements during a seizure. Don't put anything in between a person's teeth. Don't give mouth-to-mouth resuscitation, and don't give any food or water to the person until they're fully alert. You should call 911 if the person becomes injured during their seizure, if somebody is diabetic, pregnant, or has a heart condition, if a seizure happens in the water, if the person has trouble breathing or waking after the seizure stops, if somebody has never experienced a seizure before, or if a second seizure starts shortly after the first has finished. It's important to be aware of sudden unexpected death in epilepsy, or SUDEP, which can be avoided with proper seizure control, according to the Epilepsy Foundation. Someone may be at high risk for SUDEP if they have frequent and uncontrolled seizures. Seizures begin at a young age, or they miss medication doses. Occasionally, someone may be diagnosed with epilepsy, but actually be experiencing psychogenic non-epileptic seizures, or PNES, which is commonly misdiagnosed as epilepsy. While the two share common symptoms, people that are living with PNES don't experience the electrical impulse overload as someone with epilepsy would. Remember that you are your best advocate. Don't be afraid to push your provider for a referral to a neurologist if you believe you may be epileptic. Thank you so much for joining me today, and I look forward to seeing you next time. Always Best Care has been providing solely non-medical in-home care since 2009. If you're interested in learning more about our services or our assisted living selection services, please give us a call at 860-533-9343, or you can visit our website at www.abccentralct.com. Make sure to follow us on Facebook and Instagram too, so that we can show you how better options for senior living are a priority.